So you mentioned the Cost Drugs Company, which is, first of all, amazing and
Thank
very
you.
impressive. And so we have a question from another local student who has some experience with healthcare issues and wants to ask a little bit more about
Sure.
the drug company.
I'm 17 years old. Throughout the years, I've had to deal with numerous chronic illnesses such as fructose intolerance, celiac disease, asthma, and scoliosis, and my parents have had some financial run-ins because of the price of drugs and treatments in order to keep me happy and healthy. For example, I have a probiotic imported from Italy, and the reason for this is because the USA's regulations on probiotics allow them to market probiotic cultures as live, even though they might die in transport. So they could end up on my doorstep and be completely ineffective. So this is one of the many examples of, the impact of important drugs on people like me. And I know a lot of families aren't fortunate enough to be able to afford things like this. So my question to you is, how do you plan to do this with cost plus drugs, and why do you think other pharmaceutical companies aren't taking the steps required to ensure that these types of medications, life-saving medications like insulin or cancer drugs, are accessible to low-income families? Thank you so
Thanks
much.
for the question, Leanne. I hope you're doing better. The reason we started, Dr. Alex Oshmayansky and myself started Cost Plus Drugs, is because the healthcare system is broken right now. It's badly broken. And we couldn't take on all of it initially, so we decided to take on the medication side of it. But just like I mentioned, there are certain fundamental problems in the political system. There are certain fundamental problems in our healthcare system. And in my opinion, the biggest underlying issue in supporting like Aaliyah and her family and making medications affordable across the board is that we've become dependent on insurance, private insurance companies that put themselves first ahead of the actual care of people. And I think we're going to get to the point very quickly that the insurance company of last resort has to be the federal government. And I'm not saying Medicare for all, because I don't think that works, because just like the power structure of the Republicans and Democrats don't want to give up power, when you instill the power in the Health and Human Services and whoever would run Medicare for all, you're going to have the same type of issues just like you see in other countries. But at the same time, if you disrupted the insurance industry so that there were mechanisms to make all payments on a means tested basis. So for Leah, for example, the problem isn't the availability of the drugs. The problem is the affordability of drugs. And even less than the affordability of drugs, it's how families are able to pay for them. And right now, if you have really good insurance and work for a big company, chances are the insurance company will cover it. If you don't, then it's terrifying. And my position is that rather than dependent on private companies to provide insurance, that the government should be the insurer, and we should allow families like Aaliyah's to pay on a means tested basis. And what that means is, just pulling numbers out of the air, if you're a family of four and make less than $60,000, you wouldn't pay anything. If you're a family of four and you make $100,000, you may pay 3% of your income, and it's deducted from your paycheck until it's paid off. If you're at my level, you just pay for it, right? You get no sympathy whatsoever. You write the check, and then it's just stratified depending on your level of income. That way, everybody gets the health care that they need, the medications that they need, and our taxes act as the insurance instrument or the pulling of cash so that these bills can be paid. And we allow people to pay based on their ability to pay, if all that makes sense.